And so we once again have the opportunity to have a conversation with Ms. Sylvia Lemus, who is again representing the county of Sonoma to update us on what's going on. Ms. Lemus, thank you for being with us once again.
Yes, of course. Thank you. I wanted to share information on the data, the current data and the metrics that's happening. So we currently have now 28,565 cases confirmed, which is 27 additional cases in the last 24 hours. So we see the numbers going down. We have, unfortunately, a total of 306 people that have lost their lives here in Sonoma County due to COVID. But we're continuing with our testing and with the vaccines, but I'll talk a little bit more later about the vaccines. Our reopening metrics, according to the California Blueprint for a Safer Economy, which is what establishes the levels, we remain in the purple level, but there's some changes coming in. I'll talk about that. Right now, the rate of new daily cases per 100,000 is 8.2. It needs to be under 7 for us to be able to move into the red tier, but our test positivity rate is 3.1%, which has to be less than 8% to move to the next tier, so that's good. In our equity metric testing positivity rate is 5.3%, and that one needs to be less than 8% to move into the red tier. So we had hoped this last week that we would meet that metric so that we could move into the red tier, but we missed it by just 0.1%. So that 5.3 equity metric, if it would have been 5.2%, then we could have moved to the red. But there is another option that we've learned that that is possible for us to move. The governor last week announced that he wanted to provide 2 million vaccinations in the lowest quartile of the HPI index, the Healthy Places Index. So that identifies kind of like the most impacted communities around the state. A lot of those zip codes, there's 400 zip codes they identified. Most of them are in Central Valley and Los Angeles area. And so what they said is once we reach 2 million vaccinations in those areas and communities, then we're going to relook at the tiers and make it easier for people to move into a different tier. So for us, from a purple to a red. So we, as of today, we're at 1.9 million. So we're almost at the 2 million mark of vaccines in those areas in the state of California. So it could be today or tomorrow that we learn that we've reached that goal. And so that means that by Sunday or Monday of this next week, we could move into the red tier. And so that's good news for Sonoma County businesses, for operations, for our services here, because that means that things could open up a little more here in Sonoma County. So that's good news.
Definitely. And again, it's important for people to remember that we need to get tested so that we can then prove to the state that we are taking care of ourselves, that not a large enough group of people are getting sick to justify being in the purple tier, so we can get into the red tier, and therefore we can then, as you said, open up more businesses, and we can continue to move towards some type of normality, I would say. What can you tell us about testing? Are people getting tested? Are we still having trouble with that?
Yes, well, October, November, we had like some peaks in the testing and then they went down. So we really try to do a push. So we're seeing it kind of go up a little bit, but it's still important to not let up and to continue with the testing. It's very important for our community to identify cases, because there's a lot of people that are asymptomatic and they don't know that they might have COVID, and they're passing it to other people in the community and their family. And so it's really important to identify and isolate those cases and help them, provide resources. And in addition to that, it also helps our metrics. It helps for us to kind of keep our numbers low when the state sees that we're doing a lot of testing to help identify those cases in our community. So we have a lot of options, Rafael, throughout the county. I think we have around 26 options to get tested every week. And so, for example, tomorrow, Friday, we have testing on Friday at Hannah Boys Center in Sonoma, at Andy's Unity Park from 9:30 to 11:30, at Burton Avenue Recreation Center, Ryan Park, at Bear Farm from 2 to 4 in the afternoon. So every day of the week, there's testing at different locations, and it's free. We want to remind people that it's free. It's available to anyone. It is regardless of their immigration status. It's confidential. You may be asked to show an identification, but it's not required to get a test. And the results come back really quickly, 24 to 48 hours. So it's, we recommend everyone get tested once or twice a month. It depends on your exposure to COVID in the community. If you work, with population vaccinations, you might get tested a little more, you know, so, and also whether you've been vaccinated or not, it's still important to get tested, because even if you've been vaccinated, the vaccine will help you so that even if you get, because you can get COVID still being vaccinated, but you may not have symptoms. You may not even know. And so you might have it and pass it on to someone else that may not be vaccinated. So it's really important to even then continue to get tested regularly, so that we can keep our community safe until we have like 70 to 80% that's required for herd immunity, and then at that point, we can look at relaxing some of the protocols that we've been using, safety measures that we've been using. But it's really important to continue to get tested. And people can either go online to socoemergency.org. There's a testing button there with links on where you can make an appointment for the test, or you can call the number. We have a hotline for testing, and the number is 565-4667. So we have different ways of making an appointment, and we have so many options throughout the community, but it's really recommended everyone get tested.
Definitely. And that again brings us to the next item that is important, and that is vaccination. We know that in a few minutes, if it's not happening yet, the President of the United States is saying that he's going to direct states to have every adult vaccinated by the end of May, and that part of that $1.9 trillion is going to go to states to be able to accomplish this and to, again, get more vaccines. What is the process of vaccination looking like this week as opposed to last week?
Well, one of the main issues that we're still dealing with is not enough vaccine doses to provide vaccine to the community. So we have a lot of groups that are eligible to receive the vaccine, but we have the ability to vaccinate here at the county like 30 to 50,000 people per week, but we only are receiving like 7,000 to 8,000 doses a week. So we're not receiving enough doses of vaccine still here in the community. But now the vaccine is eligible for 65 and older, for people, education staff, school staff, for essential workers such as essential workers such as like restaurant workers, farm workers, people that work in grocery stores, and some other categories that are eligible. But starting Monday, that's going to expand, because it's the state is including also starting Monday the people between ages of 16 and 64 that have comorbidities, and they have on the California Public Health website information on specifics on who qualifies as comorbidities to get the vaccine. So we are, continuing to ask people for patience. We are transitioning slowly to the third-party administrator, which is Blue Shield. So we're hoping with time that we'll start getting an increased amount of vaccine so that we can start vaccinating. Like you said, the federal government is also helping all the states to ramp up the vaccination by providing vaccine and even the supportive services needed to administer the vaccine. So we're looking forward to that. And hopefully by the summer, we see a change and a difference, because if by May, June, we have everyone vaccinated, then we'll start seeing differences in everything, in our lifestyle, our economies, and just big changes. So we're looking forward to that.
Definitely. And again, it's important since it looks like the schools are going to start opening K-6. I know Santa Rosa City Schools is talking and finally came to an agreement with the teachers union either yesterday or the day before yesterday about reopening again K-6 by April. And I know that other districts are asking for that. We also learned that the governor signed a $6.6 billion bill to be able to provide funding for counties to be able to get back to the schools, for the schools to be able to open up again. What else can you tell us?
Yes, I don't have all the most recent what happened the last few days, but I do know that you're right, the state will be distributing monies to all the school districts and school systems here in California to help with that, because we have a lot of districts here in Sonoma County that have been submitting their plans for approval from the county and the state, and there's a lot that have been approved. I don't know if I have the most updated, but for example, we received applications from Santa Rosa City Schools, from Hillsburg Unified School District, Alexander Valley, Sonoma Valley, so Windsor Unified School District. So we receive plans from all of them. And a lot of that requires a lot of work because they have to provide safety for the personnel, for contact tracing, for testing at the schools, for ventilation, logistics on drop-off. The plan includes a lot of really safety measures for the students and the personnel. So all that has to be approved and put in place before they can open. But I see that it's moving towards that. And I'm not sure, like I said, you had mentioned April. I'm sorry, I don't have all the updated information, but we are moving in the right direction on that as well.
Good, good. Is there anything else that you would like to share with us? We only have a couple of minutes, unfortunately.
Sure. Yes, I just wanted to just mention to remind everyone that 211 is available for if they have any questions about resources or information. 211 has information on vaccine, testing, resources. Any questions, please call 211. Also, if you haven't already, please sign up on the myturn.ca.gov site. That's a statewide system that we'll be using for notifying people in all the communities when their turn is up and when to sign up and help them sign up for their vaccine appointment. There's also a phone number, and the phone number is 1-833-422-4255 is the phone number.
Definitely. And with that, I want to remind individuals that my colleagues and I will likely be, I'm likely going to be doing DACA applications, but my colleagues are going to be at 777 Sebastopol Road from 11 a.m. until 2 p.m. on Sunday, providing masks for free to our community. Each of the packets contains 10 masks, and we also have information about testing that was provided. And thank you as well, I should say, for providing us with the 30,000 masks and the information. And soon we're hoping you will be able to provide us with the new flyers that you have that are bilingual for sure. And so we'll be there again, 777 Sebastopol Road from 11 a.m. until 2 p.m. We're hoping to give out a few thousand masks to the community. So please tell other individuals to come by. They're free. They came from the county of Sonoma. And as a result of that, our job is just to distribute them. And I will be distributing 3,500 in collaboration with the community of Cloverdale on Monday at 3:30 in the afternoon. When people come and get their food, I will be passing out masks. And with that, I want to thank you, Ms. Lemus, for taking the time and being with us as you all will do.
Thank you.
Take care.